Yeah, I'm Joel. I'm an elected member of Youth Parliament. And so over the next couple of years, I'm going to be running a campaign on mental health and wellbeing. So I want to start with who am I? Tell you a brief bit about myself. So yeah, like I said, I'm Joel Fowler. I'm 17 years old. In April, I was elected as a member of Youth Parliament. Um, and previously, I was a deputy member. I've always, throughout the time that I've been in Youth Parliament, my sort of passion has been mental health support, like mental health support for young people. So yeah, I have a strong passion for improving the mental health support for young people, and I'm also a Year 12 student studying at Richard Lewis College. So before I go on and talk about my campaign, I kind of wanted to hear from you. So hopefully you've got Menti up. If we go on Menti, there should be a question for you there. Just give you a second to get that up. Yeah. So who do you help? I see some people have already filled it out. So children and young people. I'm sure that's going to be quite a common theme. Anyone regardless of age, needs advice or signposting for all ages. So yeah, I wanted to ask. I was going to ask sort of what service do you belong to, but I thought it'd be more interesting to ask who did help. Slightly more getting you thinking. Students from age 3 to 18, young people, a lot of young people. Good to see. Yeah, can we go to the next question, please? So what do you do to look after your own mental health? So this would be quite an interesting question to ask, because I think, there'll be a lot of people here who are so focused on sort of helping other people's mental health. Obviously that can build up. So I was thinking, what do you do to help your own mental health? Good sleep, paddleball. I love paddleboarding. I occasionally when I go to my dad's house, lives in Dorset, I do paddleboarding, but to be honest, my balance is slightly lacking. Creative, good sleep, yeah. Walking, exercise. Yeah, no, exercise is definitely a good one. I think, like, I mean, it's whenever I actually do some exercise, it always amazes me how good it actually makes me feel. Yeah, thank you. Can we go to the last question, please? So, what does your organization do to support people with their mental health? Does it, and if yes, how? So it's a sort of flip of the previous question. This one is probably a bit more complex to answer. Commissioning mental health services for children and young people. Work with schools. That's good. That's pastoral learning mentors. Yeah, it's interesting. The digital support. Emotion. Yeah, I've heard a lot about that. It's very interesting. Support online, being aware of changes in mood and behaviors. Right tools for signposting. Group therapy. Interesting. Yeah, no, thank you. Oh, still going, still going. Motion coaching, awareness days. Interesting. Lots of good stuff going on. Very good. Very good to see. Yeah, I think if that's it, then we can move on. So yeah, now I want to talk about the campaign beliefs. So this is the sort of thing that I did first when thinking about my campaign, before I thought of any objectives or anything like that. I'm just sort of the beliefs of the campaign. That's up the first one. It's pretty much a simple one. So all young people should have access to mental health support. Then we've got all young people should have the opportunity to talk to someone about their mental health. No one's thoughts should be neglected or disregarded. Teachers should have sufficient training and support to deal with students' mental health. All young people should have an understanding of mental health conditions, and no one should feel ashamed about their mental health. So why focus on schools? You can see there's quite a big emphasis on schools, and it sort of is the main focus of my campaign, really. So over the last sort of year that I've been part of Youth Parliament, I've talked to a lot of people, and I've heard a lot of stories about mental health support in schools, and I'm just going to tell a couple of them to you now. It's only sort of two out of many I've heard, and I've changed the names of these people, and for obvious reasons. So first, I want to talk about Ava. So a couple of months ago, Ava was having some quite severe body image issues. She was having quite a lot of panic attacks about the way that she looked and how she was perceiving how she thought other people were looking at her. This was sort of starting to interfere with the school and her lessons. And some of the teachers did actually pick up on this, especially when she was having the sort of panic attacks in class. So she was sent to the student welfare people. And when she was there, she was talking to a mental health support worker. And she was actually told, and this is a quote, if you don't like the way you look, you should just go on a diet. I think we'd all agree that's, it's not really that's all the right thing to say. And she's telling me how this actually made things, she said 10 times worse. Sort of she was having more panic attacks. And the other thing that she was encountering is that quite a lot, they were sending her back to class in the middle of her panic attacks. So that's just one story that I heard. Another one is a girl, Izzy. And Izzy has an eating disorder, or she did have an eating disorder. Sort of like Ava, this was starting to affect her in school. But with this, she decided herself to finally open up to the school. But she asked if they could not tell her parents because she didn't want her parents knowing about it. The school did immediately contact her parents, which she wasn't. I mean, she was obviously annoyed about it, but she could see that there was probably a reason there. But what I think is really bad is every lunch they would take her into this room, take her away from her friends and make her go, and they'd weigh her, and she'd see how much she weighed. And as you can see, this only made the problem worse for her. It made her more conscious of her body, more conscious of what she was eating. So yeah, it made things a lot worse. So that's why I focus on schools. But what I'd like to move on to is that I'm not blaming teachers, because I really don't want it to sound like I'm blaming teachers, because it's not their fault. Like I wrote here, teachers have to act as doctors, counsellors, mediators, and much more of that. And they have to, on top of that, provide an education. We really cannot expect teachers to do all of this and to sort of deal with students' mental health without the proper training. So I've just got a video here from Matt Nolan, who is sort of safeguarding and like mental health lead in my college, which is college, and he's just going to talk a little bit about sort of what it's like for teachers. So just play that video now, please.
Hello, my name is Matt Nolan at Richard Hewish College in Taunton. I'm the designated safeguarding lead and the director of student services here at the college. Mental health has been a big thing for us, especially coming out the back of the pandemic. We've seen a large increase in students. That's nearly a 50% increase of students who are struggling with their own mental health. That's for a variety of reasons. The main reasons we find are to do with being in large groups, anxieties, worries, stress of sitting exams because they've not done those before, and just generally being in a campus where there will be lots and lots of students in small areas. We've seen a rise in anxiety, panic attacks, self-harm, suicidal thoughts. All these things are affecting our students who are 16 to 19 years old. We do have a trained team of staff at college who've gone through mental health first aid training and have raised awareness around mental health across the college and can also support students on a one-to-one basis. However, unfortunately, that is not enough. We do have examples when students will struggle in the classroom. We've had self-harm in the classroom. We've had suicidal attempts on college site. And member staff, teaching staff, cleaners, kitchen staff, caretakers, support staff are all having to deal with these students and the support needs that they've got. Unfortunately, it's not always possible, and it is really, really difficult to prioritise and decide how we best support students. We'd love to train our staff better. We'd love to be able to give them more understanding and a general knowledge about mental health. In particular, prevention. How can we support those students who are doing okay at the moment, but may tip into having poor mental health, or may come across a situation where things become difficult? A family member passes away, they have financial difficulty at home, or they just struggle from day to day. How can we support those students so they don't tip into a mental health arena where they do need one-to-one care, or worse, they need clinical support? We need to ensure that teachers are trained effectively and appropriately so they can work with all students and understand mental health.
yeah, so yeah, that was Matt, and thank you to him for making that video for me. So yeah, to reiterate, I really am not blaming the teachers. I think, it's just more training is needed. So now I'm going to sort of move on uh, to the objectives. So I've just sort of explained why I've focused on schools. And now these are the objectives that I've come up with that I plan on achieving over the next couple of years. And they're sort of in order of how I'm going to do them. So the first one is going to be to consult with young people on mental health support in schools plus colleges and how it can be improved. And I've wrote some examples there, just how it's going to be done for social surveys, focus groups, and friends with personal experiences. I think it's really important to get sort of a mix of data, so we get lots of statistics, but also sort of quotes and stuff. The main reason for doing this really is to give me some evidence, really, to back me. It's all going to well me coming and saying these things, but having some actual evidence. I think everyone believes it, but having the data there really is going to help support everything I do. So moving on for the next objective, after I've consulted with young people, I'm looking to produce a report on my findings and then circulate this to schools plus colleges. So this is, once again, it will help back me. I can say, here's this report. But also, I think if there's any schools plus colleges who want to do more, but are sort of undecided whether they should, once they see this report, can really sort of help them push to do more. This is obviously only the start. So the next objective is so it's going to be to consult with teachers and mental health professionals on the training and knowledge teachers have on mental health and how to deal with students' mental health. And I think this is probably going to be the hardest objective to do. I think, as we all know, teachers are incredibly busy, especially at the moment. So actually trying to get them to have the time to speak to me is going to be difficult, but we'll do it. So yeah, this is very important because, like I say, my whole campaign really is about the training that teachers have. So I need to hear from them really what training they have, and how it can be improved. So after that, this is sort of the main thing of my campaign really. To be the start of my campaign. It's going to be to create a teacher training course, obviously with help from mental health professionals, because I definitely can't do that all on my own. And to improve the knowledge and actions of teachers towards students' mental health. And this training course will obviously include the statistics from the consultation, and then ways they can improve how they interact with students, and ways how schools and colleges as a whole can improve your mental health support. So the next objective is how am I going to get this to teachers? So I think it would be impossible for me to go around and show this to all teachers. So my plan really is going to be to present this teacher training course to head teachers and other senior people in the education sector, to encourage them to provide it to their own staff. So this can be done through attending the teacher conferences, sort of sending it as an email, which doesn't always work, to be honest. And then sort of members of the youth parliament advisory group will have me take to their schools, such colleges. So previously, I've actually, in my previous role as a deputy member of youth parliament, I did attend one of these head teacher conferences, and I think that'd be sort of the best place really to present the training and encourage head teachers to get to their own staff, because the whole point of this really is to help them out, So hopefully, and it's obviously all free, so hopefully they'll take it. So next is sort of another big thing in my campaign, or working towards that, is going to be to consult with mental health professionals and create a booklet on the common mental health conditions and symptoms, etc. So I think quite a big problem with young people is they don't understand sort of common mental health conditions. They don't understand what they're feeling, and there's quite a lot of information out there, but there's quite a lot of different information, some of it contradicting. So I think it would be really good to have this sort of booklet which says it all. And I think if we go to the next objective, is to going to promote and share this booklet on the common mental health conditions. And look, I quite like a printed version and an online version. So this is just a place that hopefully all young people in Somerset will know they can go to this booklet to sort of read about the common mental health conditions, see how they're feeling and sort of help them really. And the last objective, which is I say last, but this is going to be done throughout the campaign. It's going to be to promote positive attitudes towards mental health, and this can be done through flyers, posters, social media, and people's stories. I think quite a big problem, obviously, is the attitude towards mental health. Some people have a really negative attitude. They don't want to talk about it, they want to hide it. They want to hide it. So I think a really big part of this campaign is going to be to promote these positive attitudes, tell people, it's okay to talk about it and to get help. So that is everything from me. If you have any questions, feel free to put them in the chat, and I'll answer them.